Hello to everybody. After receiving thousands of emails asking me, please, Dr. Diego, tell me what is behind Invisalign and how can you achieve so nice results in your cases. Well, I always say that the key is investing many hours in the preparation and working your clean check. Okay, um, don't let the technician do your work or do your job just giving them a few information, because at the end what you are going to obtain is middle results, bad results. And the way I think is we have to increase to exceed our patients expectations. So let me show you. Now it is a clean check that I received today, and I try to modify my clean check as soon as possible. Sometimes it's really difficult because I have the active patients, the refinement patients, so I have many cleanses to do, but I try at least do a few of them all days. Okay, so let's do and let's check this patient. Okay, now look what we have. We have a full class 2 in the right side, full class 2 in the left side. The arc shape, I don't like the arc shape. It's a triangular shape with molar rotations. We can see the wisdom molars, and in this arc you can see the sun crowding and also the triangular shape in the lower arc. The first thing I do always is I pay attention to the upper arc and I analyze what I see here. I have sun crowding in the lower, in the frontal, in the incisors, and I see the position of the molars. So I have to think about what is my main goal. I have in my mind a parabolic arc shape. I'm thinking that I have a class 2, so I need to create a good space in the upper arc in order to solve the class 2, and I have to decide what are the movements that I have to do in order to do it in a predictable way. Okay, so if we see the upper arc, after my instructions, they have done this movement. Okay, again, and again. You can see one thing that I don't like. I'm going to do zoom. Let's see these molars. You can see that the rotation, they expand for a couple aligners, but the rest they do the rotation. They expand first, it's fine because you don't have attachment, and then they rotate. So the amount of expansion, for me, they have done really low expansion. I'm going to increase the molar rotation and the upper arc expansion, and I'm going to do the same. Don't move the wisdom molar, it's fine. Okay, thinking about the class 2, you have to think the way you want to solve this class 2. In this case, I'm going to solve the class 2 just with elastic, no distalization, and to do that I always analyze the pictures. Look where is the mandible. You can see a big circle between the lip and the menton. That's why in my case, analyzing also the x-rays, okay, I can see, no, sorry, the x-rays are not here, but analyzing the x-ray that I have done before, I have seen that the problem is in the mandible, so it doesn't make sense for me to do upper distalization. So in order to achieve this huge advance in the mandible, is necessary to create the space in the upper arc. That's why I'm going to improve. And what I do, I'm going to write in Spanish, but exactly is okay. The maintain the U shape. I'm going to increase 1.5 millimeters of expansion in each side, and I'm going to say that at the same time that they are doing the expansion, they have to do the upper molar rotation. In this case, sometimes you need to maintain the triangular shape, but in this case I need to expand and increase the molar rotation. So I'm going to ask for 1.5 millimeters more expansion in each side, coordinated con the lower arc. Okay, perfect. I like the attachments because I asked for most of them at the beginning, but in cases like this where I have lateral rotated, I like to put some kind of attachments just in order to increase the fitting of the liner. You know that with Invisalign many times we have problems with the laterals, so we can put some attachments like this. For example, I use this horizontal gingival bevel, and if you want 3 millimeters, you can click on it, change to 4 millimeters. Now it's going to have more anchorage, and also I'm going to use class 2 elastics. If the teeth doesn't have, I'm going to reduce the size, and if the teeth if the tooth don't have attachment and you want to use it, I recommend you to put. Then I put the precision cut to use the here and here. I'm going to eliminate this one. Okay, and in the lower arc, perfect. This woman, you can use cuts like this to put buttons, or you can put this one that we use to put the liner to the tooth. Okay, both work perfectly. Okay, so it's easier for the patient to use this cut where you put the button, but those are perfect. Okay, working on the lower arc, the movement looks good, but you have to think what is going to happen with the patient that is going to use class 2 elastic for a long time. What is going to happen? The lower incisors are going to procline a little bit. So in this case, even if you don't need the IPR, you have to do some IPR from canine to canine in order to try to avoid the proclination of the lower incisor. Okay, so look how is the way I think. I'm always thinking about what is going to happen if I do something in the mouth. Okay, because the Clincheck always is going to give you a perfect situation, but you have to think about things that are going to happen in the mouth, but it's impossible that the Clincheck knows for you. You know that the class 2 elastic are going to produce two things. One, the lower incisor proclination, and another, the upper incisor retroclination. So if you finish your case with the torque so straight, okay, with the angulation so straight in the upper arc, at the end you will have retroclination of the incisors because of the use of the elastics. Okay, so you have to think about this. Never finish the case with a straight angulation in the upper incisors, and in the lower arc, if you need it, do some IPR. And in this case, I'm going to say, you can mark here if you want, okay, IPR, 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 IPR. And you can decide when do you want to do the IPR. Okay, I like to have the control of everything in my cases. So in this case, I say to do all the IPR around L7 because I like. In this case, you can say do the IPR the day you put the attachments, whatever. And I'm going to ask for virtual jump at the end in order to see that we finish the case with some overjet, okay? Y ya está. That's it. This is my first modification. I haven't changed anything yet in the angulation and the final position because this is the first modification I'm doing. Then what I do with the Clincheck Pro, when I have done 2-3 modifications and I like everything mostly, what I do is I take the Clincheck Pro until the end. I use all the tools, I define the angulations, I define the minimum details that will give me a good final position, okay? So I hope you enjoyed this case. This is the way I work in my cases. I do the same in all the cases. Of course, each case has his own particularities, but my recommendation, I always say, invest time working on it. I know it takes time, I know. And if you are like me, that you do more than 300-400 new cases every year, is time consuming, but you work less time in the chair, so you have to do it. So please, it's my pleasure to be here as usual. Contact me. You can follow me in my YouTube channel, Diego Peydro, and also by Facebook. I love to share content every week. Now I'm in Dubai, we're working, giving some lectures, and well, I'm in the hotel with my pajama still, and well, giving this communication is my pleasure. So thank you very much for being there, and give me your comments if you need some more information. Have a great day.